The following is an exclusive presentation of Cablevision local programming. TV that's close to home.
Sinusitis is an age-old problem that affects children and adults.
But there are new solutions for this common condition.
And ways to avoid it. We'll have the facts for you on this week's Health Talk.
We're coming up next.
Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today we're going to discuss advances in treating sinusitis with Dr. Robert Weiss. He's an otolaryngologist and director of the Connecticut Center for Advanced ENT.
Rob, welcome back to the show.
Thank you.
We're so
pleasure.
glad to have you on the show.
Thank you.
Maybe you can start our viewers off with some basics. Let's start talking about what are the sinuses?
The sinuses are spaces in the bones of your skull and your face. To this day, nobody's really sure why they're there in the first place, but the fact is we're stuck with them. There's a belief that they lighten the skull, make it not so heavy, but they're really part of the respiratory system. So they have the same lining that your lungs have, your nose, and it's all connected. So they're all subject to the same types of problems, diseases, infections that you can get in the rest of your respiratory system.
And we have a little poster here to show our viewers exactly what we're talking about.
Right. This is just a basic image of the sinuses. There's really about 6 or 8 pairs of sinuses when you really count them out. But the main ones are the maxillary sinuses in the cheek areas. You've got the frontal sinuses in the forehead. And there's a bunch of little ones called the ethmoid sinuses that are pretty much between the eyes. And not shown, actually shown on the side view, is the sphenoid sinus.
Now these are actually holes then in the bone,
Right.
lined by what looks like mucous membranes.
Mucous membrane. So the same lining that's in your lung and in your nose is also lines the sinuses. It secretes mucus, and it's a protective mechanism. So when invading bacteria get into the sinus or invading viruses get into the sinus, the mucus is designed to sweep up those organisms and get them out of the sinus so they don't cause an infection, which is really where the key problems come, because even from this picture, you notice that you've got a big wide sinus that funnels down into a little tiny channel for it to drain out of.
And that's really an important point, isn't it? Because what you're saying is that all of these sinuses all have little drain spouts, and they all drain into the nose area.
Exactly.
They drain out of the skull and into the nose area.
Exactly. And it's when those little drain spouts get clogged, we get infections.
And I've heard some people suggest that the sinuses are like crumple zones in cars when we used to get beaten up as I guess, primitive animals. When we were
Back in
out
the
hunting
caves.
In the caveman days. Do you think
It's
that's possible?
I don't know. All I know is that they are a major problem for healthcare, in the sense that so many people get sinus infections, and unfortunately large numbers of Americans especially get chronic sinusitis.
It really is one of those things where everything's working right, we kind of don't notice them, and then when people have problems with them, though, they can really be kind of miserable.
Right, and if you've ever had a sinus headache or a sinus infection, you're very aware of your anatomy all of a sudden.
Yeah, Rob, I think it's something that may be intuitive to us as doctors that our viewers may not know,
Right.
is that normal drainage is essential to prevent infection, that any area that gets clogged in our body, gets obstructed, can get infected. So maybe you could say a few words about that.
Right. Well, again, if you look at the sinus like a space or a cavity draining through a relatively small tube, any of the secretions, the mucus, the fluid that backs up, can get infected either by a virus, a bacteria, sometimes even fungi and mold. We especially see the mold in more of the chronic situation. But the point is, the sinus, in order for the sinus to be healthy, it needs to drain. And not only does it need to drain, but it needs to exchange oxygen and CO2. When it gets blocked and that air exchange, that oxygen, CO2 ventilation doesn't occur, and the secretions stagnate and get caught back up in the sinus, that's when the inflammation occurs. The inflammation actually causes more obstruction of those small channels, and it's sort of a vicious cycle. And you can end up with either a discrete infection that goes away with one round of antibiotics. Some folks get recurrent acute discrete infections where they're on 5 or 6 antibiotics per year, let's say. Or you get a chronic situation where the infection and the inflammation never fully clear. And these folks can have months and years worth of symptoms.
Maybe you can tell us a little bit about some of the symptoms people come to a doctor to see with acute sinusitis.
Acute sinusitis, the most common thing is just going to be facial pain and pressure, usually after a cold. In general, I'm always being asked, when does a cold turn into a sinus infection? And the answer is, it's really difficult to know sometimes, because in the beginning that can look the same. You can have discolored mucus. It could be viral, it could be bacterial. My general rule of thumb is after 7 to 10 days of a cold, that's a sinus infection. If it hasn't gone away by itself within 7 or 10 days, more likely that virus has become bacterial, or allowed a bacterial infection to occur is probably the better way to say it. And now it's appropriate to use antibiotics.
And that's a really important point, I think, because I think a lot of our viewers are aware that we really don't want to overuse antibiotics either, and so we really shouldn't be treating the common cold, which is a viral illness, with antibiotics right away. But if you have symptoms, as you say, that persist or become worse, now you may have developed something bacterial.
Exactly. A couple of points to make there, that antibiotics generally do not affect viruses, so they don't shorten the illness, they don't kill viruses. But maybe you can say a couple of words about why colds and sinusitis are related. Again, it may be intuitive to us, but it affects those drainage tubes, doesn't it?
Anything that causes swelling, whether it's a virus, it could be an allergy, it could be something in the air that you're sensitive to, anything that causes
injury, even
injury, trauma, anything that causes congestion and swelling of those mucous membranes. If you think of a channel that's narrow and it swells, it's going to narrow further. If it's too narrow to begin with and it swells, it's going to close off. So it doesn't really matter what causes the initial narrowing, whether it's a virus, an allergy, whatever. The key element for bacterial infection occurring is that relative narrowing or blockage.
So that's really interesting. So any cold then could lead to sinusitis?
Potentially. Now, why do some people get colds? Let's say the average person gets 3 or 4 colds a year. One patient never had a sinus infection in their life. The next patient gets a sinus infection with every cold. That's where our research is being put right now.
With kids, I always think of kids who have smaller, because they are smaller people, have smaller drain pipes from their sinuses, from their middle. Do they get more sinusitis? I usually think of sinusitis more as an adult disease.
It's the research is showing that more and more of the so-called colds that kids get are truly sinusitis. The thing with kids is that they still have the ability to fight them off themselves. In other words, a lot of the sinus infections that children get are self-limited, and we're not exactly sure why that is, because if you look at how many respiratory infections the average child gets, if you were to...
I have granddaughters now, and it's a whole new era in getting sick myself.
That's it.
I see them often.
It's their immune system, it's their exposure. But if you go by strict criteria, you could say a lot of those are actual sinus infections. But yet we don't have to give antibiotics for all of them. Where in the adult, once it's kind of crossed that threshold into a sinus infection, most of them are going to require antibiotics to get rid of. It's unusual that a true sinus infection in an adult, a bacterial infection, is going to resolve on its own without help.
Maybe you can say a few words now about chronic sinusitis and why and how that develops.
Chronic sinusitis, if you apply strict definitions, it's a sinus infection that lasts 3 months or more. There's gray zones there in terms of what you would call a chronic sinusitis. I also consider adults that have recurrent infections, let's say 4, 5, 6 a year, even if they clear up in between, that's a form of chronic sinusitis, or more specifically, we call it recurrent acute sinusitis. But it still implies that there's an ongoing problem, that there seems to be an underlying reason for that. So the typical chronic sinusitis patient may complain of, they may have the intense, let's say, toothache type pain that an acute sinusitis patient might complain of, but they may have chronic headaches, they may always be congested, always have some kind of secretions out of the nose. Their sense of smell is usually affected in a poor way, smell and taste. Also, they're more prone to develop nasal polyps and other sort of advanced things that can happen.
How about post-nasal drip? A lot of people complain of prolonged coughing spells after simple colds.
Absolutely.
Is that a sign of a symptom of sinusitis?
It could be. Unfortunately, post-nasal drip is one of those symptoms that can occur in many different things, and we've actually been very surprised at sometimes when the patient is convinced they've had post-nasal drip from the nose, it ends up being something like reflux from their stomach. So you got to be a little careful labeling symptoms sometimes until you really investigate what's going on.
So some of the symptoms you've described are fairly nonspecific. Congestion, we call off some dull discomfort, headache. What's your threshold for beginning to do more aggressive diagnostic things, and how do you make the diagnostic? Are there any symptoms that say, a patient walks into the office and say, oh, that's definitely chronic sinusitis?
For the most part, acute sinusitis, I don't rely much on testing. I'll go by the story and the exam, and usually I think 90% of the time we're going to be correct and correctly prescribe an antibiotic when it's indicated. For chronic sinusitis, you really have to rely on imaging.
So X-ray studies.
X-ray studies. And in this case, in today's era, we're talking about CAT scanning. And we can show some images in the next segment.
What are you looking for on the CAT scan?
Essentially, we're looking for those air-filled spaces to be filled with something. So whether it's going to be mucus, pus, inflammation, fluid of some kind, maybe an anatomic blockage that we can actually see on the scan, that's what we're looking for. If we see nicely aerated sinuses that are full of air and the lining looks healthy and thin and it's not thickened, that's not chronic sinusitis. When I look at a CAT scan, that's what I'm looking for. I'm looking for anything filling those air spaces that shouldn't be there.
In addition to the X-ray images, are you doing any other kind of tests or cultures or anything like that?
On cultures are a little tricky because if I swab a nose, I'm going to get all sorts of bacteria that are going to grow out of it. So you've got to be very precise what you're culturing in order to know if that is the pathogen that's causing your problem. So sometimes I'll actually see what I will consider bacterial drainage out of a sinus, and using telescopes in my office, I can use a very finely directed catheter to sample that. I feel confident that's a good culture at that point. As far as blood work, generally not helpful. Allergy testing, it's going to maybe tell you about why someone is predisposed to get a sinus infection. It's not going to really help you in the midst of treating
How about fever? Do you see fever in either acute or chronic sinusitis?
Kids. Adults, it's pretty rare. It's got to be a pretty bad sinus infection for them to starting to get these systemic symptoms like fever, chills. Little unusual for sinuses. Sinus tends to be more localized. So they'll complain of a focal, point tenderness, a toothache type pain, a headache.
The last question before we go to a break. In my old days as a beginning physician, we used to shine lights up through the roof of the mouth, trying to see whether we could determine whether a sinus was fluid-filled or filled with air.
Exactly.
Is that useful, really useful?
Well, it's interesting you mention that because what is old is new. And we'll talk about this later. The newer technology is utilizing just that. It's a transillumination that we put directly in the sinus, and it will light up the sinus. And it helps us as surgeons know where we are.
That's a great segue to our next segment. Thanks for this great overview.
Thank you.
When we come back, we'll talk more with Dr. Weiss about sinuses.